All right. Hey, everybody. It is Dr. Rimka with Brain and Body Solutions in Atlanta, Georgia. I'm often called sometimes your brain optimization specialist, but I'm also called a rest revolutionary now because I'm kind of leading a movement about sleep and rest and how important that is, especially for women. And even though my special guest, that's not her main message, but her focus is a big primary subsection are women. Now, I know you do see men as well in your practice, but I want to introduce a friend of mine, Dr. Leita Harris. She is a gynecologist practicing out of California. She's in Corona and Indian Wells, California. So if you're local to those areas, please know I'm trying to give you a great resource right in your backyard that you may not have known about. And what I try to do on the Brain and Body Solutions business page and my YouTube channel is bring you, it's not just about me and what I do, but I want to bring you the resources so you can optimize your health. There are practitioners who don't do, what I do. She's a gynecologist and a bioidentical hormone replacement specialist. And I got to tell you, Dr. Harris, nurturingyou.com is a genius website name. So right there, I want you to know you have a physician who's chosen a website name that actually resonates so deeply with somebody like me in the holistic world. So you already know she's different. And so I like to bring to you people who kind of bring an old school bedside manner and physicians that focus on caring and compassion and communication and know that to get their patients well and even beyond well, to optimize and in a peak performance state, because it's not about just not being sick, it's about being how magnificent can you be. Our doctors like this who know you can't do that in a 10-minute visit.
Exactly.
So Dr. Harris, tell everybody, all the people who know me, who don't know you, a little bit about who you are and what you're up to in your practice and how they can reach you.
Well, great. Well, thank you so much, Stephanie, for inviting me, first of all. Every single thing that you said resonates so powerfully with me. And that is the decision why, although I was traditionally trained with the full obstetrics and gynecology practice, after doing that for about 15 years, I started realizing that there was something that was missing. And I actually felt like I was doing my patients a disservice. I decided that I was going to step outside of the box and do my own training, learn from other resources, because what I was trained was not really giving me the full picture. And it certainly, at that point in time in my life, was actually making me feel, I'm going to say guilty. I was really feeling guilty for the things that I was prescribing and doing that came just out of my training. So I kind of started just going outside the box. As I said, I started training on using bioidentical hormones and understanding what it is. And it actually came around the time, many people remember the time back with Dr. Suzanne Summers, okay, and Dr. Oprah Winfrey, okay. So a lot of women started finding out about this because of the Women's Health Initiative study that came out and started freaking everybody out about hormones. And I was like, wait a minute, there's something more to this than just the surface. So once again, I kind of just started digging a little deeper. So I just pulled away from the obstetrics part of the practice. I started treating women with hormones, with bioidentical topical hormones. I found out about pellets, and that just totally took everything to a whole nother level as far as management, giving people options essentially. So, but I wasn't able to do all of that very comfortably underneath the setting of like these big multi-specialty practices, which I did for the first 25 years of my practice. So back in 2015, after 25-year mark, I just decided I need to pull away. And it was very sacrificial because financially, obviously, but there was no way I was going to continue to stay underneath the roof and be limited, like you said, and just feel like I was pressured to, 10 minutes, 15 minutes, that's all you have. No way. I have to sit down. I have to, listen first and foremost. I need to establish what your goals are. What is it that you're looking to benefit, and then educate you let you know what the options are, and then us become partners in your wellness, your health and wellness. We work together, because I don't want to be just saying, okay, this is what you need to do. No, you need to know that this is going to be something that's going to complement and enhance your health, so that you're a partner in it. And that's the way we get people to be compliant. That's how we get people to say, like, okay, if you're involved with it, then your spirit is involved, your mind is involved, and you're going to make decisions that's going to let you go in that direction. So there was no way, like I said, I could do it underneath the traditional multi-specialty. So I pulled away and I started Nurturing You Women's Health and Wellness. And I'm grateful that over the years that, because of the fact that I was also trained in taking care of men and their low testosterone, that I'm also treating some men. So I tell the men, as long as you don't have a problem coming to see your gynecologist, then I'll take care of you.
That's a really impressive man. Well, I got to go see my gynecologist. She's amazing. I love it.
Yeah. So, and then I also use other, I look at things from the broad standpoint as well. I look at lifestyle. I don't just check your hormones, because I understand that just your sex hormones is not the only thing that I need to address. I need to look at you as a whole person. I need to look at what's going on with your thyroid function, your adrenal function, what's going on with your metabolic state, what's going on with your lipids, everything. I need to look at everything and address everything. Mm-hmm.
That you are speaking my language. Obviously, I've been in the holistic integrative world for a very long time, because I was classically trained differently than you. You were trained to get apart. And you guys, for those who are watching, I think you could hear some of what was involved in there, but it takes a lot of courage, you know, for a traditional physician to break out of that. It's only something like 10 to 15% of physicians are in private practice anymore. You guys, because the hospital, the large groups, corporate groups own most physicians. And I always try to tell my patients, I said, here's the thing, I defend a lot, like, they don't have a choice. If they take more than 10 minutes, you can lose your job. It's the numbers that you're told you have to do. So it takes a lot of courage and a big risk. I've had to, we have to own our own businesses, and that's how we know from day one, but that's not really how physicians are trained. You get jobs and you get a paycheck and you get direct deposit, right? Owning your own business is a different situation. And so congratulations. And it's very different to go get a space and get leases and, you took a risk based on your moral compass.
And my passion So absolutely.
I have such mad respect. You guys, you need to understand, supporting your functional holistic providers, whether that's physicians, chiropractors, acupuncturists, health coaches, it's critical. So because we won't stay in business. And so you want somebody to spend a lot of time with you and look at you as an entire human being, mind, body, spirit, soul, then, you have to use our services. So, well, I don't, you know what I mean? Like, it's a reality. Like, I know it's a risk, right? You had a cushy job and you could have stayed there, and it's a different situation, but I've seen a lot of the stuff you're doing. I see that you have, like, you give free lectures and there's workshops, and I see the kind of stuff you do, and it's really, really inspiring and empowering. What you said is what I'm always going for. I tell my patients or students in any of my online courses, I'm not trying to be your guru. I'm here to be your guide. And that's what you said too. We want to move you from feeling like a victim into being empowered.
Yes.
Exactly. This is why we're doing this, and you're a partner in this. I love that.
That's right.
That's real healthcare. You can't get healthy without being a partner in it. Right?
That's right.
But even though you're wearing a white coat, in your field, there's a lot of white coat syndrome problems going on. And I think that's why patients don't feel they can be a partner, because they put the physician up on a pedestal as if you know everything and they know nothing. So I think maybe there's that dynamic, that might be at play. So what would you want to tell people who are watching and they might think, oh, wait a minute, maybe I need to look her up. And again, it's nurturingyou.com for her website. And we'll give your Facebook and Instagram handles and stuff. But what do you want someone to know like if they're the right fit, or what would, like, if this
Hmm.
is, you should call me if, you should really come and
Right.
see me if,
Right.
it's me who
Right.
I'm looking to help.
Right. Well,
Who would that be?
I think the biggest portion of my patient base right now are those women who are dealing with hormone imbalance. They've gone to doctors who want to prescribe them Prozac,
Yeah.
or tell
Oh, that's
them,
a big one.
or tell them
Oh,
that, sorry, you don't have any options. Hormones are going to just cause cancer. And so they're left to suffer, and they think that there's no options. It's almost like someone is just telling them, okay, you're mid 40s, you're potentially going to live a whole nother life. Okay. And so you're going to live the rest of that life miserable, feeling, I mean, and I don't want to go over all of the symptoms, but if you're that person that someone has made you feel like there is no hope, that you just have to stay in a state of imbalance, that's kind of like my biggest draw, if I can put it this way. So people who just have been kind of just shoved aside. Also, someone who wants to have a physician who's going to sit down and, like you said, spend time with them, because unfortunately, people have just been they've been so part of the traditional clinic practice that they think that the only way to see a doctor and interact with a doctor is speed doctor. Okay. Speed doctor. Before as they asking a question, the doctor's hand is already on the doorknob walking out. Okay. And so I literally, it's so fulfilling and rewarding to me when I can have someone who's pouring out their heart. Okay. Feeling like someone has made them feel like there's no hope. Literally sometimes breaking down and crying, and just, they're blurting out everything. And I'm telling them it's all because your hormones are imbalanced, and I can help you with that. And so when I give them that feeling of like, wow, really, there's something that can be done. And it's like, there's a whole lifting, even just knowing that something can be done, and their spirit is lifted and they feel hopeful.
yeah.
They feel hopeful. That's the kind of person that is going to be. I think that's my main gist of the patients that I'm seeing, because I think there's just way too much, this lack of information, this misinformation, there's fear that's being put in, and it's sad. And I'm going to do my best to reach as many people as I can so that they know. And that's why I do free seminars. That's why I go whenever I'm invited to speak. I go because I want to share with people. I want to give them the information. And of course, what they do with that information is up to them. But I'm going to let them know that there is someone who does care, who will spend time, who will listen. And again, like I said, we'll partner with you and we'll help you get back where you need to be.
Right. Get results. That's the reality, is that people don't know that they have choices. And I think what you're saying, it's a part of it's aging. It's aging powerfully. And like what you said, is like I'm 47, you get to an age and it's like, well, I've had women say to me, well, menopause, they're like, oh, well, those are the devil years. And that's just what you go through. And I'm like, no, I'm not having it.
Exactly.
I'm not, that ain't going to go down over here, because I have science. I have science, people. And I have, physicians like you who are well-versed and can take care of me.
That's
and that whole story of, I won't put that in my consciousness. My brain doesn't believe I'm determined to feel miserable in my 50s, in my 60s. I'm like, it's a beautiful transition time.
Yes,
and I will be held with grace. But you're kind of like a midwife going into menopause. We used to have medicine women that did this, and it wasn't. This wasn't, we've been so brainwashed, like periods are supposed to be painful and horrible. You're supposed to be moody and crabby. Menopause is supposed to be hell. Not true. Not true. If you're having painful cramps, you need to see her. If you're having a bad menopause, issues, you need to see her. Right. Because this is not normal. Actually, we need to put you in balance. People don't understand about hormones and brain function. So there's a lot of this emotional component you mentioned, that mental illness gets constantly misdiagnosed. I've had, and on this, we'll end with one little small anecdote, and I'm sure you've seen this, because what I love about what you're saying is I could come to see you and get help with me. My husband can get a little bit of help. Our hormones can stay in balance so we can be charging and sparking each other.
Right.
A lot of sexual energy, because that's important. And my daughter can come to see you because we think she might have PCOS or what's going on, right?
Absolutely.
So that's what's really cool, kind of like that family, Dr. Quinn medicine woman thing going on. But like, I've had men come to me, and again, I deal with mental health, mental illness, brain imaging and stuff. And then I see their labs, and they have less testosterone than I do. And they wonder why they're moody and weak and low energy. I go, first of all, you have a thyroid disorder and a hormone disorder. You're aromatizing estrogen. This is not good. Did they tell you this? So, and they're like, no, nobody said it.
No one says, I can't tell you how many times and literally, when you look at the list of symptoms that women experience, menopausally, and you look at the list of men that experience from low testosterone, it's an identical list other than erectile dysfunction on one side and absence of menses on the other side.
And for some reason, they just want to go give them, Prozac or Xanax.
Right. Exactly. So, and I love the fact that, again, the men patients, they've come and they've just, I'll never forget one of the first ones that I did. When he came back, he just said, I can't believe that this has been the solution to all of my symptoms that I have been experiencing over the last 2 years. I can't believe that everything is reversed, and I can't believe that this was the solution, there's not a connection that's made, and that's why we educate. That's why it's imperative that we help people to understand that these things are all related to deficiencies and imbalance. So, and I went through my own craziness when I was your age. I was 47 when it started happening with me. And like I said, there's no way I couldn't even function, to be honest with you. I couldn't think straight. My sentences were disappearing. My cognition, my memory, never mind the physical things. So, but it was just one of those, like, I can't live the rest of my life like this. No way. I'm 59 this year, and I feel great, and I know and I got a lot of life to live. That's why I look at it. I got life to live.
That's right. Well, things to do and places to go, and that's what it's about. That's what it's about. Connection and living life to your fullest. My definition of health, for me is like the brain, you're craving and desiring something in life, and the body says, no problem, we can do that. You want to go skiing? Got it. You want to play basketball? Not a problem. You want to go on a cruise? I got you, boo-boo. But many of us are craving to do, and we go, oh no, I can't do that. My knees, I have arthritis. I'm tired.
Exactly.
Oh, my moods. I got to joints. That's not health. If you want to do something in your mind, but your body says, oh no, I can't. I'm scared. That's not health. We got to get you to where it's in alignment, and your body says, I got you. No matter what you want to do, I can do it. Right?
Unlimited,
right? All right, limitless. All right, so Dr. Harris, thank you so much. Tell everybody, all the people, again, it's nurturingyou.com. What about Instagram?
And on Instagram and Facebook, it's at Dr. Leita. So DRLEITA. And so
beautiful. Thank you guys so much. She's in Corona, California, and Indian Wells. Where's that near?
Palm Springs, Palm Desert.
Okay. All right.
Yeah, that way.
California's so big, I can't keep up.
I know.
All right. So see you later. You're welcome.
Have a fabulous day.